My name is David De La Rosa. I'm an LPN case manager and I work for Generations Horizon Ridge.
My name is Tamika Hyder. I am a unit clerk at the Kearney Mesa Skilled Nursing Facility.
My name is Lydia Garcia. I'm in housekeeping and I work at Arbor Hills in La Mesa.
My name is John Busker. I'm a CNA here at Stanford Court Nursing Center in Santee.
My name is Vanessa Villalobos, and I'm the Medical Records Director here at the Lompoc Skilled and Rehab Center.
I'm Katrina Austin. I'm an LVN, and I work at Lakeside Special Care Center.
My name is Rowena Talavera. I'm a LVN, and I work at Canyon Oaks Rehab Center.
Hi, my name is Lizeth Ramirez. I am a certified nurse assistant. I'm currently working as a unit clerk for both of our nurses stations at Castle Manor.
My name is Ruth Hurst. I'm the rehab aide over at Friendship Manor National City, and I've been working here for 17 years.
My name's Robinson Rigoforte. I'm an LVN from Newport Nursing and Rehab.
My name is Lourdes Saldana. I work at Heritage Park. I am dietary aide.
My name is Yvette Ablog, MDS nurse for Smith Ranch Generations. I've been here since the conversion, 2017. As an MDS nurse, I facilitate and oversee the completion of resident assessments. I work with the IDT team to develop care plans that has long-term and short-term goals for patient improvement. And I also am responsible for the accuracy of medical records and coding procedures so that the facility can get proper reimbursement while complying with federal and state regulations. I try to make a difference every day, especially at work. I try to help everyone out. I feel that if I help a nurse complete a task, then that gives them more time to take care of the patient. I put the patient in the center of everything I do. If I answer a call light, then that means that patient doesn't have to wait for a CNA. So I try to work my day just thinking about what I can do better for the patient. The people that inspire me to do what I do and be who I am are my children. I want to set a good example for them. I want them to see that being a nurse, it's not just going to work every day. It's having compassion and kindness. It's taking care of people that are not able to take care of themselves at the moment. So I want them to see that we can all be kind, we can all be compassionate to anyone that we meet.
My name is Rika D. I am the Admissions and Marketing Director for Tunnel Skilled Nursing Facility. So it started in 2011 when I met my first administrator, which is Tim Castleman. We went to a party and then he approached me and said, you know, I really love your personality. Would you like to work for me? And at that time I was working for Target. I didn't know anything about healthcare, but he was willing to teach me and show me, you know, what I have to do. He hired me as a social service assistant at St. Francis Heights, and then from there, that's when I started my healthcare career. So I basically build relationship from our community partners and also making sure that employees are taken care of, and you know, they kind of boost their morale. Mostly like a cheerleader really for Tunnel. So I really I work with our administrator Starry to make sure that the staff knows that they are well appreciated. So one of my main job is to build that relationship and continue the relationship that we have, and of course to be the number one in the city, to be their go-to SNF if they need a short-term rehabilitation, and that's including, you know, with the doctors, the case management, social worker, and also community partners, because we are such, you know, we're in the heart of San Francisco when we have so much things to offer in the building. So my job is really to be out there and be there, you know, to represent Tunnel. I think it all started when our father needing rehab. At that time I was working for a different company, but I felt like Generations was a good place for him because I used to work for them and I know how they are when it comes to
taking care of our loved ones. So my dad was actually at another generation's building, and then he's able to go home from there. I feel like if ever I'm gonna go back to a company, it's gonna be Generations, because they take pride on what they do.
My name is Lilian Chavez, Generation Healthcare, Walnut Creek, California. I have been here for 10 years, and I am a CNA and RNA. I try to live the mission assignment every single day, caring for my patients. That this comes naturally on me, because that's me, that's what I want to do. Care for the patients, be kind, help them in their needs, because they are special. That's why I'm here, because I want to do the best from my heart to them. Make them feel comfortable, make them feel that they have someone to take care of them. My main inspiration is my mom. I remember when she started become disabled, so I was working really hard to support her, to give her the best quality of life. Of course, I want the same for the patients, you know, a good care, the best quality of care. Since my mom, I remember when she did take care of me, she did with a kindness, with a compassion, with all the love that a mother can give a child. So that's why, and I want the same from me to my patients, because they are special. I don't see them as a patient, I see it like a part of my family. What about if they are my relatives too? So I want them, for them, the best of the best, because they deserve it. One day in the future, I am young right now, but in the future, when I become, you know, and I probably ended up with some special needs. So I want the same thing for me. You know, whoever works with me, they treat me with respect, with kindness. They give me that dignity that I deserve as a patient that I can be. So that's why. And I have to say thanks God too, that He impact my life too. I am a very religious person, and I always, before coming to work, I always tell thanks God for giving me the chance and the opportunity to go to work, to have a job, and to have especially this kind of job that it is beautiful. When you see this kind of job with all your heart, it is not a job. It is just something that you want to do because you really wanted to do with love. It is not only a check. It is not only because you have to be paid. It is because you do with all your heart, with all the love that you want to do to your lovely ones.
My name is Jinky Herrera. I'm a licensed vocational nurse. I work at Lawton Healthcare, and I've been there for 10 years. I do doctor's orders. I transcribe doctor's orders. I make sure that the orders are properly carried out, and I make sure that the nurses are aware of the new orders so that they can administer the medications on time. I do patient and family teaching in preparation for discharge. I go over medications one by one, and I make sure that they have the proper follow-up appointments for when they go home, and make sure that they have the necessary equipment for them to use, the walker and the wheelchair that the rehab is prescribing for them. The part of the mission statement that I really like is being professional in what I do, and I try to maintain that, and I know that it will affect other people in the work area. The persons that inspired me are my children. My children are my life. They are my motivation. With what I do at work, I have a lot of people at my work that really gives me this encouragement and support. I want to thank Natasha Daragan is my DON, and Mary is the assistant DON. They are the best of two people that really encourages you. Me, not just me, but all the staff, very encouraging. And I want to thank both of them for always being with me and for the support that they have given me every day. Mr. Dan Daly, my executive director, he's been a good leader, and he's a good boss. He's a good boss. It's been great working under his leadership. He's very professional, and it's easy to work when your boss is also your friend.
My name is Neza Raginan. I'm the Director of Staff Development in Vista Manor Nursing Center. My daily responsibilities include I'm mainly the educator. I provide in-services and orientation to new hires. I'm also responsible for providing adequate staff for best quality care, and I'm also responsible to ensure that the hiring process is complete and make sure that those new hires are well-oriented before they go to their respective departments. I remember one patient which I think I feel like I made a difference, because she was admitted here, which she is very, very weak. She has all these tubings, she has oxygens, Foley catheter, and then G-tube. She cannot eat through her mouth, she cannot walk, and she cannot talk. And then every morning as I give my morning medication, I used to hold her hand, and she just smiles. And there's one time after a few weeks with rehab and with the interdisciplinary team, she held my hand. Instead of me holding her hand, she squeezed my hand and she said, "Thank you." And I feel like that was the first time that I heard her talk. And I feel like the interdisciplinary team did a great job, because she was discharged home. She was very happy with the service that we provided to her. My favorite part of the mission statement is the last part of it, where it says, "It is our purpose that whoever enters Generations home will be met with kindness, competence, and compassion," because that is everyone's goal that works in a facility, especially Generations Healthcare. And being me as Director of Staff Development, I make sure that I instill that to those new hires so that it'll drive them to give the best quality of care to our residents. If there's one person that would inspire me, and which is still my inspiration right now, that will be my mom. She is a superwoman. She has supported me all the way. I wouldn't be who I am today without her.
My name is Joanne Gentry Hadley. I work for Sienna, for Generations also, and my job title is RNA, and I wear many other hats other than RNA. My main impact for this building is the dining room. I make sure, to the best of my ability, to make sure that all their needs are being met. When family comes to visit, that there's a spot there for them. I learn their habits of, this person wants tea, this person wants cocoa, this person needs salt, that one needs jelly. I really get involved in my dining room. My dining room is my passion. Well, my building is my passion, but my dining room is the top passion. I really oversee it. I work breakfast, lunch, and dinner. I hate it when I have to go home for my 3 days off, because that's my job in the dining room, and I want to make sure that whoever's in there runs it the way that I run it, and that is to making sure, as the best of my ability, that their needs are being met, that I'm aware of facial recognition or paying attention to them, and are they happy or they're sad, do they need anything. But that's my baby. My favorite part of the mission statement is that we need to strive to better the care that we provide for our residents, to make sure that their needs are being met, and to treat them as we would want to be treated, how our mother would want to be treated, our grandmother would want to be treated, our Father, put ourselves in their place to help make sure that we are meeting their needs like we would want to meet our needs. Sometimes when you come into a job, you are just working and you don't pay attention to those needs. You always must put yourself in their shoes, walk their mile, and understand what they're going through and try to make their stay and their recovery better for them. Not so much easier for us, but better for them. And to pay attention, sometimes a hug, a smile, a touch. A lot of times these people don't get a touch. And a hug and a touch is like $1,000,000 to them. So that's my statement that I think Mission is trying to tell us and to tell everyone else, is to be open-eyed and pay attention to our residents' needs. The whole building knows the person inspires me is Nikki Kilgore. She is my love, my passion. We both feel the same way about Sienna. We would do anything for Sienna. She's my backbone. She's my backer-upper. She's my ear that if I need to talk to somebody, my advisor. Like even this morning, where are you? Help me with this question. And she was right there.
Hello, my name is Benigno Cornejo Gonzalez. I'm the maintenance supervisor in Pleasanton Nursing and Rehab Center. My main responsibilities over here in the facility is like maintain the floors. We do electrical jobs. We do plumbing. We paint. We fix wheelchairs. Basically, we are a handyman over here in the facility. And this year, I took a new task. I'm responsible for keep the life safety book updated and the whole system and the facility. I really like the new challenge. I always show compassion, kindness, and always try to be professional on whatever I do and make them feel comfortable working with me or when I'm working with them, and see the smile on their faces is just amazing. And it's really important to spread the love, make them feel the love that we have over here for them. Well, the other day, I think it happened last week, one of the residents in the hallway, he called me and he asked me if I can fix his wheelchair. And I told him, yes. Let's see what we can do with your wheelchair. And what's the problem? I told him. And then he started explaining me what was the problem. So when I was fixing his wheelchair, he told me, Jose, I really feel very comfortable talking with you, and I feel comfortable to ask you to fix my stuff. That type of conversations, those experiences, made me feel like I'm doing the job, like I'm doing a good work. When I see residents happy with the work I do, and he tried to get involved in the process when we were fixing the wheelchair. So at the end, we do the job together. Teamwork made the difference.
My name is Nicole McCullough. I am Social Services Assistant and I work at Gramercy Court Skilled Nursing Facility. I do psychosocial assessments, I assist families, I assist patients with their discharges, I assist in discharge planning, I review baseline care plans, assisting my supervisor Anita with a variety of things that she asks me to do that's within my job description. Just come to work and just be happy and just be me and just get to, you know, enjoy my patients. My favorite part of our mission statement is being caring. Caring and loving. I believe charity is the most important thing of all. And being able to come to work and actually live that mission statement is awesome, because I have so much love in my heart, and I'm able to express that with my patients and family, and be able to come to work and do that. And I'm not sitting in a place where you have to just be quiet and you can't be you, you know, and, you know, just being caring and learning and growing, learning every day, and just come to work, you get to be happy, you get to be you and express you, and just, you know, give that love back to, you know, that person that's in need, that, you know, that you never know what they're going through, what life tragedies they had, and just, you know, just a simple rub on the back, a simple, you know, how are you today, and a smile or anything, you know, just being able to do that and be able to give, you know, it's just awesome. It's awesome. So many people, I can say, made an impact on my life, but most of all, I would say, is my husband. He's so awesome. And today made our 10-year anniversary. He's so awesome. Every day, you know, have a great day at work, where's my smile? You know, he just tells me to continue being you. Don't ever let nobody take your shine. Just continue smiling and being you. And, you know, that makes me feel good right before I go to work. And my children, it's just, they're awesome. Administration here, this is my secondary family. All the, you know, my employees, friends, family, it's just, you know, it's just awesome. It's all awesome. My mother, you know, I'm very religious, you know, God, I mean, gives me the strength every day to come and just love myself and be me, and it's awesome.
My name is Kamaljit Sharma. I'm an MDS coordinator and case manager for Medicare patients, and I work for English Oaks Nursing and Rehab. My main responsibilities as a MDS coordinator and case manager are I have to finish MDSs for all the new Medicare patients that we get. Also, I have to attend care conferences, any PPS meetings. I have to do case management for those patients as well, see if they need any health teaching, and I have to attend triple check and any other meetings that come in. My most favorite part of the mission statement is treating everybody, family member or a patient, with kindness, and also show that we care about, you know, the patient and their family members. So I will continue to do that with a smile on my face every day when I walk into English Oaks. Somebody who really inspired me when I was hired at English Oaks was my administrator, Deanna Hill. The way she always supports the team, and you know, she supported me when I was hired there. I learn a lot from her every day that I come to work, and if I have any questions, I know I have the support. That, you know, it's there. I know she is there for us. And I also want to thank our Assistant Administrator, Mary Lee, and also our Director of Nursing, Tracy, and my MDS consultants, Mary Bell. She's just great. I can talk to her about anything, and she's always ready to, you know, help us anyhow she can for MDSs. And also Jason, he's been very good and just communicating back if we have any questions. He always gets back to us really quickly. So I just want to thank everybody for always guiding me and just supporting me. So thank you.
My name is Melody Dulay, CNA of St. Francis Pavilion. As CNA, I provide basic care to our residents as well as assist them in their daily activities such as eating their meals, bathing, dressing, grooming, and toileting. My favorite part of the mission statement is caring for the sick, the elderly, and the infirm, because it is a special and sacred stewardship. That means caring for the sick or the elderly to maintain the quality of their life as a person and to be respected as I want to be respected. There are people out there who need help, and I want to be the one who will help them. The person who inspired me to do this work is my parents, because they taught me how to help other people, how to be kind and loving as they want to be loved and respected.
My name is Carmen Escandor. I'm a CNA at St. Francis Heights for 14 years now. I live the mission statement like my everyday job, like how I handle the resident and how I treat them with kindness and compassion. And I treat them like a family to comfort them and make sure that they are safe and happy. My mom is my biggest inspiration in my life, because without her, I think I wouldn't be me today. She taught me to be nice to everyone, and she taught me to work hard. I think that's why who am I today. Thank you very much for whoever voted me to put me in this award. Everyone with my co-workers, co-CNAs, especially Cordell Erickson, our administrator, and Virginia Bolos. Thank you very much for everybody.
My name is Inez. I'm the Director of Admissions here at Plumtree Care Center. My job here at Plumtree Care Center is to ensure that I have good relationships with the community outside, hospitals, doctor's office, and making sure that patients are happy here after they're admitted. Walking in a building, the presentation is key. I think they want to have a great experience here, making sure that the hallways are cleared, building is nice and clean, making sure that our staff is professional. Communication is key as well, making sure that you follow up with the new residents after they've been admitted. I think our staff here, whether it be the maintenance, CNAs, nursing, management, giving them that experience is great. When I first started here, I admitted a patient short term. She transitioned into long term here, and her husband was at another facility long term. He had been sick, and family had asked us if we can bring him here to join both parents here to be with each other during his last few days of his life. And I transitioned the patient here to our facility. We were able to get husband and wife here together during his last days. I'd like to thank department heads here, my team. They work very hard to make my job easy, from walking into the building and having maintenance, housekeeping, CNAs, how hard they work here, nursing staff, and social services, to main boss, administrator. He does a great job. And I'm really grateful that I've been chosen to receive this award.
My name is Molly Ackerman. I'm the Business Office Manager at Cedar Crest Nursing and Rehab. My main responsibilities are overseeing the department, which bills the primary insurance, the co-insurance, and the residents, depending on their insurance coverage. My favorite part of the mission statement is the whole concept that it's our duty to take care of people who need our help. No matter what that person's situation is, no matter what their personality is, you know, they deserve care and compassion, and we incorporate that into everything that we do. I would say the person who has probably inspired me the most would be my mom, because she raised us to have compassion for animals, but also for other people, even if those other people were didn't always have compassion for somebody else. I would like to thank the entire team here at Cedar Crest, because when I first considered the position of business office manager, it was really daunting, but the team here has been really supportive in helping me settle into the new position and just given me the support and encouragement to succeed at my job.
I'm Victoria Mendoza, Director for Staff Development, Bayberry Care Center. As the DSD, I need to ensure that the staff are competent to perform their job by providing training and education for them. I also handle the HR part in the building, so I need to make sure that their certificates and licenses are up to date. Their employee health records are up to date, that they get their annual physicals and their TB screening. And I also handle the work-related injuries. I make my rounds every day to ensure that the residents are getting the best care possible, and also to make sure that the families are happy about the care. Our mission is really to provide the best care for each and every one of our patients, and to make sure that we build a lifetime memories with them. I come to work with that mission and ready to touch everybody's life possible to make sure that they get the best care. The people that inspire me are the people that works for Bayberry, because just like me, they come to work and carry to their heart and mind that mission statement of generation. So it's a big part of who am I today. We make sure that as a team, we provide the best care for our patient, and that they leave the building when they're ready for discharge with a smile on their faces. And it helps us because with their experience, they give it out to the community and say that they get the best care in Bayberry.